Powered by the Montana Television Network. This is the 5:30 News on Q2, Montana's news leader.
Good evening, everyone. Thanks for joining us on your Monday. I'm Jeanelle Slade. We actually begin tonight with a little bit of good news surrounding COVID-19. New data shows a major drop in projected confirmed cases, hospital impact, and COVID-19 deaths. And tonight, if you are confirmed positive and you don't have health insurance, we take an in-depth look at your options. Well, the projection model being used by the White House Coronavirus Task Force appears to be easing up on potential damage across Montana. Well, today that number shows the number of projected deaths drastically dropping from 270 down to 22. Now, the University of Washington says modeling projections change, and with more data collected, it appears social distancing is working here in our state. The model has also scaled back the projected number of hospital beds from 852 to 45, and ICU beds from 129 needed to just 8. Well, here in Montana, the report also shows the peak resource need for hospitals moved from April 26th to April 13th. Now, 319 people have officially contracted the illness across the state. 6 patients have died. Of those new cases, 7 are from Yellowstone County, 4 women and 3 men. Yellowstone County now sits at 47 cases. Gallatin County, the state's highest tally, now sits at 118 positive tests. 89 of those individuals are under the age of 60. Now, Governor Steve Bullock has not yet extended the stay-at-home deadline of April 10th, but is expected to do so in the coming days. Well, the numbers look better for Wyoming as well, but projections still predict more than 100 deaths across the Cowboy State. After another week of data collection, the new projection is 114 deaths compared to 145 and a small shortage of ICU beds. The peak resource use in hospitals is still projected later in the month on April 29th. In Wyoming, as of this afternoon, the state now has 210 cases. Wyoming remains the only state in the entire country without a single reported death, and one of the only without a stay-at-home order. Laramie, Teton, and Fremont counties still have the highest number of cases. Well, tonight we're learning Montanans who don't carry health insurance or may have lost it when they got laid off because of the virus, they may be the most vulnerable. So we sent Q2's Andrea Luce to find out what resources are available if you find yourself in this position.
It seems there may be some heavy barriers for those still working in jobs where they cannot telework. Jobs like the service industry, servers and drivers, cooks, even construction workers. It's these workers that may face the biggest challenge if they do end up getting the coronavirus, because they report they have no health insurance.
And it's these kinds of jobs that have an increase in the risk of exposure to COVID-19, according to research from the Kaiser Foundation. The study says in 2018, nearly 28 million non-elderly people in the U.S. lacked health insurance.
I think that is the key to this right now. It's like you can't wait until you have an accident with your automobile and then go and get insurance. It doesn't cover it then. People need to go out right now and be covered.
Montana Commissioner of Insurance and Securities Matt Rosendale says there are options if you don't have health insurance right now.
Don't wait until you get sick. Don't go uncovered. That is really a big thing.
The state of Montana offers short duration health plans where you can sign up at any point in the year. Rosendale also says if you recently got laid off, you could be eligible for COBRA benefits through your previous employer, but premiums could be much higher. Health insurance through the federal exchange is still an option because losing your job is a qualified circumstance through the Affordable Care Act. And there is some good news for those who still do have health insurance.
Anyone whose physician has recommended that they get tested for COVID-19, that test is free of charge, and all the major health insurers here in the state have waived all the co-pays and deductibles in association with that testing.
The Families First Coronavirus Response Act was signed into law in March, which may ensure more uninsured can access free testing. However, the legislation doesn't necessarily address coverage of treatment if you do get COVID-19 and don't have health insurance.
Whether you're going to have a conversation with your landlord or whether you're going to have a conversation with your insurance agent, as soon as you see that you're going to have difficulties in making those payments to any party, contact them immediately, because we are finding that everyone is making provisions and trying to work together so that we all can get through this very, very difficult circumstance.
In Billings, Andrea Lutz, MTN News.
Thanks, Andrea. Now, Andrea says it's unclear if Congress could back additional programs to cover those without health care. Well, for people without a home or place to isolate, the process of waiting on COVID-19 test results can be a major challenge. Normally, people are told to self-isolate at home until they get those results. Well, Yellowstone County is now ready for those who don't have a place to go. Q2's Mitch Laggy checked out the facility at Metro Park today and is standing by with a look. Mitch.
Jeanelle, Yellowstone County disaster and health officials have been working to turn one half of the Montana Pavilion at Metro Park into an isolation and quarantine space for people without a place to go. If people who are facing homelessness or domestic violence are waiting on COVID-19 test results, they are taken to the pavilion to wait out the testing process in isolation. The facility is divided by curtains into 10 feet by 10 feet squares and is currently set up to hold between 30 and 50 people. People will be able to use the bathroom, take a shower, and get a hot meal with 24/7 security provided by Metro Park. The facility is scheduled to be operational by Wednesday at noon.
For the homeless people who don't have a place to be sheltered when they get released from the hospital. So we're providing them a place to come to be isolated and quarantined. So they're either awaiting the results of a test or have gotten the results of a COVID-19 test.
And again, Neil said that the isolation site should be ready for use by Wednesday at noon, but he said he hopes there are no people there to use it. Jeanelle, back to you.
All right, us too. Thanks so much, Mitch. Well, he says the isolation site will be staffed by organizations in the Continuum of Care Coalition. That's a group of 25 local organizations already working with the homeless across the Billings area. Well, there's also now a donation site for personal protective equipment for our local healthcare workers. N95 respirators, surgical masks, and face shields are all needed, as well as disinfectants like Lysol wipes and hand sanitizer. So if you happen to have some extra items, they are being collected at the Sandstone building on the Metro Park campus. To set up a donation time, call 406-208-8154. Well, after a tiger from the Bronx Zoo tested positive for COVID-19, concerns have risen for the safety of our domestic pets. This is the first case in the U.S. of an animal contracting coronavirus, and as of now, it is believed that the tiger came down with the virus through a handler. The big question is whether or not an animal can spread COVID-19 to humans or other animals. We spoke with local veterinarian Edie Best, and she tells us more information is needed before we can draw any conclusions.
While we know that a few animals have tested positive that have lived with or been exposed to a human infected with COVID, there is no evidence currently that pets can transmit back to people, or that pets are necessarily getting sick with the disease.
And Best recommends if you have been diagnosed or are feeling symptoms of COVID-19, try to distance yourself from your pets as much as possible until we learn more information. Well, we now turn to Ed McIntosh with weather, and the thunderstorms are heading our way. I know this because I could feel it in my joints earlier today.
Yeah, it's just you could feel the pressure
Yes.
changes as we got into the afternoon. Let's go ahead and take a look with the Doppler network here this evening. You see a few showers around and occasionally a little bit of heavier rain in a few pockets and some snow up into the higher elevations. Looking across our immediate area here in the short term, things are fairly quiet after a nice warm up, but through the evening hours we have a chance of a few isolated showers and thunderstorms. Brief gusty winds and brief rain are probably the bigger hazards, but as we take this off towards tomorrow, watch the blue arrows start to move down across the screen. That's winds increasing into the afternoon. Take a closer look at that coming up in just a few minutes.
All right, thanks, Ed. Well, what sounds like it could be good news may not be so great. The Montana Department of Public Health and Human Services has seen a sharp drop in reports of child abuse and neglect since schools closed due to COVID-19. As MTN's John Riley reports, state officials are concerned with this sudden decline.
Since the governor directed the closure of public schools on March 15th, state officials have seen a drastic drop in calls to the child abuse hotline, which has raised red flags for DPHHS. From March 8th through the 14th, the week prior to the closures, 765 calls a week were being made to the hotline. Since the closure, the number of calls has dropped by more than 40% to an average of 425 calls a week. DPHHS says this shows just how important the role of teachers play in a child's well-being.
And in addition to the community, they're our eyes and ears. They see children every day, and they know them as well as anybody. So it truly is, they're an important piece.
You don't have to be a teacher or a member of Child Protective Services to report negligence or abuse. Anyone can make a report anonymously at any time.
Just because we're in a pandemic doesn't mean that a family struggles, and if you see something, if you suspect something, then do something.
DPHHS recognizes that these are unprecedented times, sufficient with financial insecurities and stresses. No two situations are exactly alike, and there is no shame for a family who is struggling to ask for help.
And if people are having struggles, if a family is struggling, to make sure that they're asking for help, make sure that we're reaching out to people and seeing if they do have everything they need, or how can people help. Yeah, we want people to call the hotline, but we also want people to be watching out for their friends and neighbors before something happens, before there's child abuse and neglect.
Reporting in Helena, John Riley, MTN News.
Thanks, John. Now, April is Child Abuse Awareness Month, and in previous years, hundreds of pinwheels would fill the state capitol and Montana courthouse lawns. But due to COVID-19, people are encouraged to make pinwheel art and display it at home. Then families are also encouraged to post on social media with the hashtag #pinwheels4prevention. Well, ahead on tonight's 5:30 News, we'll take you to a restaurant in downtown Billings that's ready to add a little comfort and joy to your home in these times. And in sports, Scott shows us what adjustments college athletics are preparing for to make sure the fall season is a go.
You're watching MTN News with Jeanelle Slade and Russ Riesinger. Storm Tracker weather with Bob McGuire. And sports with Scott Green. This is the 5:30 News on Q2, Montana's news leader.